Situs Maasi to our audio crew for sticking with us and for resetting us after we have just a limited time for that recording. So we're beginning it again. I want to thank all of you who've been waiting. We've been going for over 3.5 hours now. I especially want to thank those who've come to testify tonight and for their patience. I also want to thank the senators who have been with us all night, including Senators Duenas, Senator Therese, Senator Brown, Senator Ada, and Senator Blas, and Senator Moylan, Situs Maasi colleagues. All right, I'm opening up the panel now for the senators to ask questions. Again, we're having this hearing so that the senators can ask questions and satisfy themselves before they vote on the resolution. So I thank you for your patience and your answers tonight. We'll begin with the author, Senator Duenas.
Situs Maasi, Madam Chair, and I also want to join you in thanking everyone for being here. I'm going to start by going to the current and the former PAG chairs, because what I've been listening to tonight, Madam Speaker, and what I listen to in the community is what's coming to this confluence is a difference between restrictions and mandates and a public health emergency of a crippled healthcare system. Because that's essentially what I've heard all night, and I understand that. I'm not saying I don't understand that. But what I'm saying is that it seems to me, with this line of discussion, we could be in a public health emergency for the next 2 years in terms of building the system and doing what we need to do according to the mobilization of resources that have been discussed at this point. So I guess I'll start with you, Mr. Berg, Dr. Berg. The discussion on the PAG, my direct question to you is, what is the difference when we're discussing the public health emergency and when the PAG convenes between mandates, the correlation of mandates, restrictions, and that science based on what's been presented today in terms of and I'll use, I guess, Margaret Artorio Chima's line here. Please reconsider your resolution taking into account the fragile healthcare system and all of the discussions associated with what I completely understand in terms of the fragility. However, I think what we need to do is get to the bottom of what type of correspondence and what type of effort is there between the mandates, the declaration of the mandates, the lifting of mandates, and what's been presented today in terms of the fragile healthcare system.
Sure, let me do my best to answer that, and thank you for that question, because I think that you're hitting at the heart of the difficulty that we have as a medical and administrative and public health community, and indeed as a legislative body, in trying to figure out how do we deal with our pre-existing fragile healthcare system, because it's very frequent that people correctly point out that 10, 15 years ago, we used to see it on the newspaper every day, the number of hospital beds that were available. And even when GRMC opened, we continued to struggle to provide inpatient care, for example. And there are waiting lists, and we don't have such specialties as gastroenterologists and pediatric cardiologists, and we could go on and on about why our system is fragile and has remained fragile. The difference between the baseline fragility and the current fragile state couldn't be clearer, in that, for us that is, in that both need to be addressed. The way that we respond on Guam currently to the pandemic, which is indeed ongoing, as I mentioned, is different than places that have a more robust healthcare system, where there is an ability to deal with wide swings in hospitalization rates and infections within the community, that can handle the amount of endemic diseases that pre-existed COVID, that is like diabetes and difficult to control hypertension and things of that nature. So when we look at it, we have to say, wait a minute, there's no question about it. It is, I guess I could put this on you, not you personally, and not on any specific individual, but on the leaders in the community to help going forward in terms of making our system less fragile. We'll never be completely like a large continental-based community that can reach out to adjacent communities, that can get medications and staffing in very quickly. We're never going to be there, but we want to get as close as possible to that. We deserve that. So going forward, we want that. But what do you do now? You have to say, well, if we have a big surge, as we had in early January, we were pretty well prepared to handle that because we knew it was coming. We don't always get that luck. So we have to be ready to turn on a dime and be able to quickly get people in. So one of the perspectives that I've given is the ability to very quickly ask for federal resources, the very apparent need to get people in quickly. As I mentioned, 500 nurses. There's just no physical way that could have taken place given our current health professional licensing office infrastructure, which is built for a non-urgent situation. So we have to separate out the pre-existing fragile system that hopefully we'll work together to improve versus where we are right now. And we can't change the underlying system right now. We're trying to do so. And I'll give you an example where we have made, because people have said, and I feel really badly when people say this, it's because of lack of knowledge. It's not because I think they're mean. When they say nothing was done at GMH, the amount of hours that people like Jolene Uggan put in to help prepare us for the next pandemic, not just to react to what's going on right now. Someone just needs to walk into the ICU, ask for some pictures, and you'll see the extraordinary amount of effort that has been made to get us ready. So just in case it comes back. For example, these very large monitors that allow for highly experienced intensive care physicians who are awake in the East Coast of the US and the central portion of the US to cover at night. Most ICU care can be handled very effectively by having an ICU experienced trained doctor available at any given moment. Basically, they live in the ICU, but just by remotely, they're wide awake, so they're not up late at night in the ICU when mistakes can happen when you have overnight people. And you have on-site hospitalists who may not be ICU level trained, but they can consult immediately, like so readily. They're right there and they're sitting there waiting for us to consult them. That is going to stay in place after the public health state of emergency is out. But we often need to get new people licensed to be available for that type of care. And if the numbers go up, we need assistance during the day and we need to add them on very quickly. So it's really unfair to criticize GMH for saying they haven't done anything. My big fear is actually it's been burnout. Now the legislature has been clear in thanking them. And I appreciate that because you can't thank them enough. It's very similar to a veteran. You cannot thank a veteran too many times for the service that they provided to the country. You really can't thank the people at GMH and GRMC who have put themselves at risk and not just been reactive, but proactive. So to answer your question directly, we will work together as a community to improve the baseline so we are better prepared, as best prepared, maybe you could say, while still knowing that right now we need the resources of a public health state of emergency to be able to turn on a dime. Forever? God, no. I hope not. I pray not. The same as you saying 2 years, I sort of sat back and said, I hope not. But I think you and I both know in December, we were ready to, give high fives and say we're done, and it didn't happen. I really feel confident that we're not going to go back to that situation. But I have to admit, I felt confident in December too. So I don't have an answer to you as to how long do we have to be steady state, low level. play it by ear. I will tell you that the federal government, in their decision-making regarding the national declaration for state of public health emergency, said they will give 90 days notice before they lift it. So I think, we've had the discussion with the governor, by the way, saying we have to plan it out, but 90 days notice is okay because that gives you time to undo it. So is it forever? No. 2 years? I certainly hope not. Is 90 days notice when as I mentioned, the consultation with public health officials, and the governor has in fact consulted with many others to make that decision as to when to say, okay, 90 days from now, if we continue to be stable, we lift the state of public health emergency. Yeah, I'm okay with that. And I think the PAG would be too. Your question was a little general and not in a bad way, but I'm saying, so I may not have answered specific questions. I'd be happy to do so.
Yeah, I'm going to get more specific when I turn to Dr. Wen then. I thought I was specific enough in that, but I'll try to hone it down a little bit more. So once again, as I said, and I want to be clear, I heard a lot tonight about the legislature work with the governor. We have been working with the governor. We have had a bill that was put in place to do this every 30 days, and there's no reason why we shouldn't have. This 3 hours, 4 hours tonight is really nothing in the grand scheme of being able to meet here and discuss these things where we have to make decisions because we have to balance. We understand completely what the deal is with the healthcare system, but we have to balance all the other needs of our community, business community, others knocking down our doors saying uncertainty and different things. So going to you, Dr. Wen, I think that you kind of hit it. The note that I was looking for was, what is then the duty and the responsibility to mesh this discussion on this, obviously the fragile healthcare system, and don't pass a resolution that is actually in law to do what we do as a body, and how to work with the physician advisory group and the governor to understand these things, working also in concert with the community, because we have also to balance that issue.
Yes, our healthcare system is very fragile, before COVID and now, and even after COVID go away. The hospital, GMH, RMC, as much as our staff work as hard as they can, the bed capacity is not going to be enough for the island. That's why we need to expand them a whole lot. So there's no change in the fragile healthcare system. Now, during the pandemic, we put mandate and restriction, and there's totally different things together in order to control the surge and help, take the burden off the hospital. And with COVID, everything is dynamic. We got to change, with the situation in hand, just like with Delta is different, with Omicron is different. So we put the mandate there, just like the vaccine mandate, the mask mandate at the beginning, in order to control the surge and control the severity of the infection on the patient and cut down the hospitalization. But at a certain point, mandate, we set the goal, right, at 80%, 90%, and when we reach there, the mandate have to change. It cannot stay the entire pandemic. But that's a decision that needs to be based on scientific data and also from the community physician. That's what we see. By the time they get to GMH, they're the last defense already. We at the clinic level are really the post-ultimate pandemic, and you have to change the mandate based on where we stand and based on what variant we're dealing with. So we cannot stand still. This is a very dynamic. Restriction, the same thing. We restrict the movement of people, we put barrier with all kind of stuff, but it still need to change with the situation. So, it's very dynamic. It can change today. What we see today, we change tomorrow. But we have to work together with the governor, with public health, with the community physician and the legislature. We have to balance out somehow, but cannot be on the pandemic emergency forever without an input from the whole community. And again, it changed with the situation.
And that's the point. My colleagues have sat here as long as I have, so I'm not going to take any more time. I'm sure they have great questions as well, but I mean, that was the whole purpose of Bill 11. I mean, we could do this once a month. We can get the information once a month to know and to establish this. That's what it means to work with the legislature and the governor and the executive branch. To have that communication out to the public, because this is what the public pays attention to. What we do here and how we work with the front office. And that's the whole thing. I mean, we can do this every month. There's no reason why not. And we don't have to pull every single one of you away from what you do. But the fact is that dialogue needs to happen, because aside from that, we're working here, and it doesn't make sense. I've heard very compelling testimony tonight, and I understand that. And none of us wants to shut down a public health emergency, lose money, and kill people. That's not what we're here for. None of us is here for that. But we do have to have open lines of communication to make decisions that are balanced across our community. With that, Madam Speaker, I'll turn it over to my colleagues.
Thank you very much. And yeah, with all due respect, I'm just going to remind all the senators and those answering, if you could just be as direct as possible, because we have a standing rule that requires us to end at 10 p.m. so that we don't conduct business in the middle of the night. That's the gist behind that. Although this is a very important discussion, I very much appreciate your patience. All right, Senator Taitigui, you're recognized. Senator Taitigui.
Thank you, Madam Speaker. And first, I'd like to thank the panel that came first, for coming and standing up for what they believe. And it takes a lot of courage for them to do so, especially, coming in the face of doctors and those in the health community. So I want to thank them for testifying this afternoon. And I also want to thank the health community for all they're doing. Especially, you gave us a history of what's transpired in the last 2 years. And I'm starting to see that we're seeing the light at the end of the tunnel right now. And I think that's what it's all about. It's finding a way to now transition to be able to, this pandemic to be the norm now. I mean, this is now moving forward. We're going to have to take all these precautions because it could happen again. I was just asking one of my colleagues here, what was the emergency response plan that was put in place for government Guam 3 years ago before the pandemic happened. There was supposed to be some kind of plan put into place. So I'm hoping that, with all the history that you provided this evening to us, that along with that, you're also considering a plan as we come out of this pandemic to move forward on trying to find some kind of normalcy. But again, a plan is going to be needed, so we can, we need to start talking about a plan. The question I do have is in public health with regards to the SNAP program. And I'd like to ask Tess, regarding the comments that you made, the testimony you provided. It didn't say anything about losing SNAP funding. I do know that, if I'm not mistaken, there is something making the PHE, the public health emergency, and there was mentioned that on April 15th, that the federal government may no longer provide that additional service. I don't know if it's Medicaid and SNAP, but there is, I'm trying to find it here, I'm sorry, I wrote it down here. Tess, what is FFCRA? Does that make any sense? Or the FNS regional? I think public health provides this on a monthly basis.
The It's FNS, Food Nutrition Services. We actually provide supplemental. This is on top of what the regular SNAP clients are receiving because they don't get the full benefits or the full, it depends on their income. So they don't get the maximum benefit that they're getting. Some of them, if it's for household size of one, let's say, because they have some sort of income, so the benefit is reduced. With the supplemental SNAP emergency allotment, they get the full benefits. And so in a monthly basis, we average roughly 2.3 to 2.4 million in addition to their regular benefits that we are infusing into the economy. The reason being is because these clients are also working. So, but then again, because of pandemic, their income had, let's say it's reduced. Like what I stated earlier, based on the unemployment, it's 4.3 prior to pandemic. With the pandemic surge, it's 16 plus the unemployment. So can we say that we're back to 4.3? Are these people all working now? Are they full-time? They need these benefits. Right. So once we issue the expiration, then we're also going to end these supplemental benefits.
Okay, so yeah, that's what I wanted to make clear. In the event that this emergency health has been rescinded and over, then the federal government would no longer subsidize us or supplement us, not subsidize, but supplement us.
They're just going to provide an additional 1 month from the time we end the public health emergency. So let's say we end it April, then they're going to put an additional 1 month. That's all.
Additional one. Is there any talk of it ending soon? Because you remember as long as the Secretary of Health continues to declare an emergency, that the funding will come to the.
Yes.
Okay, so as long as they maintain that status, that we will still be getting that supplemental, even if, the subsidized or funding. But even if we were to exercise the resolution and stop it, then even with the public, the federal side, they would still stop the funding coming, even if,
okay.
Because you know what I'm talking about when we had this conversation with regards to.
Let me clarify.
Okay.
If we end it now,
right,
and let's say the national PHE ends in July 30, then we're not going to get that supplemental SNAP emergency allotment up to August. We're supposed to receive it up to August if we end it in July 30. So if we end it now, let's say March, then we're only going to get an additional 1 more month, which is April. So we're going to lose that. My take is, can we sustain if we not receive this additional funding? Can we sustain the needs of our people? More than 1/3 of our population under Division of Public Welfare, more than 1/3 of the population of Guam is under our program right now.
Are they on the national level, are they planning on not continuing it or canceling it at any time?
Well, actually, because they have 60 days to inform us on when they're going to end it. They did not inform us. So that means it's extended. So based on our conversation with, I guess I'm talking about CMS, well, it's also FNS, then it's extended up to 7/30.
Okay.
I mean, 7/30/2022.
Okay, you said when they do cancel it, they're gonna let us know within a 2-month period?
Within 60 days, they're
Within
supposed
60
to
days, 2
inform
months,
us.
right?
If they did not inform us within that 60 days, then it's extended for another month, kind of.
Okay, so we are now in April, coming into April. They have extended it, so we should be there till May, correct?
Right now,
To the end of May.
it's up to 6/30/2022.
I'm sorry, say that again. Say that again.
June 30, 2022. So they did not inform
22.
us 60 days prior to that.
Okay.
So the likelihood is 7th July
Okay.
2022.
Okay, 22.
2022, the likelihood.
Okay, thank you for that. And thank you for that clarification with regards to the SNAP program. And the situation on the national level on whether they're going to extend it or not. I appreciate that. Other than that, I really don't have any more questions. I appreciate all the comments that you brought and took the time to write your testimonies out. We have a lot of copies of them, so it gives us a chance to really go over them thoroughly. I know it's late at night, but I appreciate all the work you're doing. I appreciate it. Thank you, Madam Speaker.
Thank you very much, Senator, and thank you for, I know you have much more questions, but are being considerate of the time. Senator Brown.
Thank you very much, Madam Speaker. I also appreciate all the time and efforts the members of our community and certainly from our medical community have provided this evening in providing us information with regards to Resolution 291. I do have to state, and it's always a question of how do we balance the interests of the community and the voices of our people that for quite some time have come knocking on our doors in wanting to ensure that their rights as members of this community to be informed and also have their freedoms recognized. It's not something that we can ignore. And I understand from the medical side with your expertise coming forth with the testimony that you have provided. But at the same time, we also have members of our community that are saying we're not informed, we don't like decisions being made on our behalf, and we don't like being left in a situation of where we're in the dark, where decisions are arbitrarily being made for us, and we're not engaged in that process. As elected officials, we are here to represent those views as well. The last time I checked, this was a democracy. And while I understand during times of emergency, unlimited circumstances, we can appreciate the fact that the executive is being given emergency powers, but it's not intended to be permanent. And we have gone now in a 2-year period with a lack of engagement. I mean, I've been in the legislature, a year and 3 months back, and this is the most information I've had come forth publicly with regards to where we're at, what the impacts will be, and what we need to do. Hopefully, I appreciate Dr. Wen, you coming forth and saying we do need to put an exit plan in place. If the administration is putting one in place, they've not provided any information to the legislature, at least the bulk of the legislature, with regards to that. There's also concern in our community, and some that I very vocally have relayed, is the abuse of power. There has to be a check and balance. We are not a community of one. I'm not here to bow to royalty. We have to be engaged because we are impacting the lives of our people. Yes, we want to protect our people, but we also have to protect their rights, of which the authority that we have comes from. That's very basic in our democracy. We cannot be powered down and impose our rules upon our people without having their engagement and their approval. And that's what's been happening for quite some time. And that's why there is a sense of dissatisfaction. We cannot live in our own little bubbles and be removed from that reality. The other thing is the fact that because of the lack of transparency in this process, and maybe from your end that on the government side, for those of you that are on the government side, maybe you don't see it or don't feel it. But for the rest of us, including those of us who are elected officials here in this community, this information is not forthcoming. We have substantial financial funds that are coming here on behalf of our people, and yet most of our people, including those of us that have been elected to help raise these issues, have no idea how millions of dollars are being spent in this government to address the pandemic, or if they are properly being made to address fully the pandemic. We have no specifics. We have ARP money. We have close to $400 million that's still sitting, and we don't even know how the couple $100 million were spent prior because there is no specific information being provided, and that's the concern. If this authority is only left in the hands of a few without that check and balance, the opportunity for corruption to thrive is possible. We have one member here in the private sector saying they're having difficulty procuring. And yet under emergency procurement, where we're not required to meet a lot of the procurement requirements, we've had millions of dollars of procurement that have happened. And are they legitimate? Are they proper? Or are they only being given to people that are connected? Those are the questions and concerns that are coming from the community, and they're certainly coming from the rest of us that are public officials that are also duly elected by the people of Guam. And so I don't have questions because a lot of you have already elaborated from your perspective what your concerns are with regards to ending this pandemic in terms of us terminating this emergency health care power issue. But the issue is coming to a head publicly one way or the other. We cannot continue, nor can the administration continue to operate in isolation of the rest of the community. I've been on both sides of the aisle. I can imagine from the perspective of the administration what a burden the Guam legislature must be. I can appreciate that. I've been on both sides. And from the other end, being here in the legislature, we cannot have a government that in and of itself only operates at the level of the administration, and yet come back to us when they're in trouble and say, oh, you need to fund this and you need to fund that. We need to be responsible. But in order to do that, we need to have the information at hand, and we need to have engagement beyond just these press conferences that are controlled, and then us having to call hearings because we either have a legislation or a bill before us or a resolution to engage. And sad to say, for all of you key people, this is the level of engagement, and it's unfortunate because it's unnecessary. You ask us to work with the administration. We're here. We're the same senators you've been seeing for the last year and 3 months. We have no problem working with the administration. Many of us are very well skilled and very experienced of being in the administration, so we can appreciate that. But I do want to relay these concerns because they're very real and they're out there. And as you are asking us to keep in mind the position and concerns you have, we know there's no permanent state of emergency. We understand there are deficiencies in our overall healthcare system. But we do have to prepare for the exit plan because the public and the rest of the economy that we ultimately will be dependent on to survive in this island, their concerns also have to be addressed because we cannot live like this indefinitely. Our people are already getting very frustrated, even with these mask mandates. It's coming to a head. So I ask you to please keep that in mind, and we're here, we're open. I mean, the governor asked, why didn't we call her? Well, hey, we're here. We're always here. Odds are every public hearing you've attended here, we're here. We have no problem working with the administration. But I think there has to be that effort also made to not work in isolation. This is not all about power. If we're not using it for the interest of our community, what value is it to the people that put us in our respective positions? I mean, election year, it's always election year. But I think for the time we're here, we have to be responsible. And I appreciate, Dr. Wood, your input. I would like to request that exit plan. If you are in public health or the GMH, do you have an exit plan? If I can just quickly ask, I know we're running out of time, and I know my other colleagues have not had a chance, but I do want to ask that question. Perhaps Lillian from GMH, have you guys even started dialoguing with regards to what the exit plan is? To step out from this emergency status, because we know it's not going to last indefinitely. What's the plan?
You know, Senator, I always invite this body to come to GMH and ask us these questions. There's nothing that we do that we can't explain or aren't willing to meet and answer questions. I think the reality of this particular pandemic, and again, it's a 100-year pandemic, right? So I get it. We want the timeline. We're all tired. We didn't plan to have a state of emergency for 2 years or 5 years or 1 month. We all wished it was. Believe me, I was traveling when the emergency declaration was made. It was made 2 days after I came back from Japan, and I sat in a meeting with the advisory group, with the with the surgeon cell, and was told that in 10 days from now, we're gonna have 6,000 people in the hospital. That was the projection. The reality of this viral illness and ongoing pandemic is we don't know the answers. There aren't any answers. Every month, every 3 months, every 6 months, new data comes out. And we all want to say, we're done, don't worry. Are we in a better position? In some ways, yes, because there is data now. So we do have some medications. We have a very willing public to get vaccinated. We have, those things are in place. Does that mean that we have a clear ending point? No. Unfortunately, that's not how it's worked out. So every day when we meet once a week, we have a COVID huddle, we have discussions, and we asked ourselves the same question. Is it time to lift the visitors policy? How can we get visitors back in the facility? But it's a debate. It's not, we all agree. Some of us have some feelings about it. The importance of having family members. My mother was in the hospital a few times during the pandemic, and I'm the only one who could see her. Well, I'm one of 11 kids, so that was extremely difficult to be working full-time and trying to, and my mother is a nurse, so she would just stare me in the eye and say, "Where were you?" It's like, well, I'm over there. But so I think we know that what people are feeling. We're people too. We have families. We're working all the time, and I wish it were like TB or some other disease that we have experience with, that we could just say, hey, when you get this and you get to this number, 2 months later, we'll be done. And we've gotten to that point. For sure, many of the mandates have been lifted, the restrictions have been lifted. Once people got back to school, we said, unless it seems to be killing people, try not to close the school. That wasn't in the very beginning. It has evolved, and I think that's the difficulty, is you're asking, and it's not, again, limited to Guam. I think every jurisdiction, and we get the recommendations we get from the CDC, everybody reads the journals, and we do the best we can. But increasingly, that's not enough, and again, everybody's exhausted. I don't even want to read the thing anymore. Can you imagine the doctors that are actually taking care of the sick people? How much reading and adjusting, and so it's been a very difficult time, and that's really what's going on. I think Dr. David tries her best to assimilate the information so she can give you the best recommendation in line with what the CDC says. Now, lots of people the distrust of the government and of each other is growing at an alarming rate. So everybody can find one study that disputes something. That doesn't make it, as U.S. physicians, we go by the U.S. recommendations. Are they always 100% correct or not? No, because it's new. And as much as 2 years is a long period of time, it's not at all a long period of time for a new disease, and a disease that keeps changing. So I think, I know that's not satisfactory, but that's the reality and so I don't know what the answer is. And a plan, well, yes, we have a plan. We have 50 more airborne isolation rooms. We have 18 brand new, hemodialysis units, because that's a population that's particularly, we work with the outpatient dialysis unit to make sure they can give dialysis to COVID positive patients. Because if they all have to come to the hospital, even though they're not sick enough to be admitted, but they need to be isolated because they can't give it to the other 900 dialysis patients. So yes, we've had lots of progress. Is that an exit plan? We go by, okay, it's been 8 weeks, and 390 employees that have caught COVID, so that decreases our ability to take care of patients. So we can't take risks by declaring that we're ready to respond to the next surge, because if we're down 200 people, we have 2 years of exhausted healthcare workers. We can't guarantee that they'll be there. So I think, as everybody's been saying, it's a dynamic thing, and I think maybe the public needs to hear that more. Maybe that's not satisfactory, and I agree with all of you that at some point we have to figure out how to live with this. But I think I disagree that restrictions haven't been less and less and less. They have been. People are going to restaurants. I think eventually, as some of the other jurisdictions and as the CDC has recommended that we can decrease mask mandates, they will be. But I think it just takes time, and it's an extremely slow process, and that's all I can offer.
I appreciate that. I mean, I know time is running out, but I think it confirms certainly the position that the author has with regards our main sponsor, with regards to this resolution, that dialogue needs to take place, because the governor in and of herself does not have the sole authority to run this island. It does require the legislature's authority as well to concur on that, and if we do have the votes to impose this resolution, then that shifts the dynamics. But that is the reality of the authority that our people have given us. There is no single branch of government that has the full authority to impose their will upon the people without question. And so I simply think it supports the argument that we need more dialogue and engagement collectively as we move forward. With that, Madam Speaker, thank you for the opportunity to comment and ask questions.
Thank you very much, Senator Brown. Senator Blas.
Thank you, Madam Speaker, and I'm going to try to rush through this because this guy's got a lot of questions next to me. First off, thank you very much for taking the time. And thank you very much for giving us the reason as to why this resolution exists. I hate saying, guys, but thank you for building the case for this resolution. And I'll tell you why. It's because we're having this conversation, the conversation that we couldn't have over the last 2 years. This could have been totally unnecessary had we had this conversation. And to say that none of us here in this body has ever attempted and tried and reached out to the administration so that we can have a discussion on these things. I learned a lot over the last 4 hours than I have over the last 2 years. Has it changed my position on this? Absolutely not, because again, your presence here has brought even more conviction to this. One of the things that you're all concerned about, and I guess we're all concerned about, is basically all the powers that we're going to lose, that's going to be lost, all the bells and whistles that are going to be gone as a result of us lifting the state of emergency. Have you ever thought about maybe having a discussion with us so that we can recognize what your problems are and maybe draft legislation, draft policy, so that we can help to ensure that if the state of emergency doesn't exist, but you still need these things, that you have that ability to do that? You ever thought about that? I didn't think so. You've given us a lot of ideas and basically how to be able to craft legislation so that if the state of emergency is lifted and you still need those nurses, you still need that ability to be able to access funds, you will be able to do this. We live in a democracy where laws and policies are basically crafted and designed as a result of discussions with the community and what the community concerns are. And granted that the last 4 hours, this whole discussion about lifting this emergency was about the healthcare system, everything. Remember, we've also got the inherent responsibility to some of the concerns. Because you see, when this healthcare emergency, when this thing is lifted, and you still need the money, guess who has to go find it? Guess who needs to have the discussion with the other aspects, with the other facets of the community, so they can continue to provide the revenue, to be able to collect the taxes, to be able to fund your areas. So this lifting, this whole discussion about lifting this healthcare emergency, or the state of emergency, is not just about the healthcare, it's about the health of the island. And it's your continued health. It's making sure that you continue to have the ability to be able to function. I'm very much interested because we had this discussion and these things to be brought up. Tess, you brought this up continuously. And as far as if this state of emergency were to be lifted, we can no longer access or be availed to federal funding. Is that in writing?
Yes, from FNS, yes. And then from CMS, actually, because we did not, as I stated earlier, because we increased the reimbursement rate of our provider, so they did not issue or they did not inform us of the emergency, of the PHE that will end within 60 days prior to the ending. That's why it's extended up to June 30, 2022. And they did not inform us again 60 days prior, so its likelihood is extended up to July 2022. So I would say for CMS, we have an additional 6.2 federal percentage, which will end September 30, 2022.
So
that's for CMS.
So this is more of, those are decisions based on basically a federal state of emergency.
For medical.
But it's a federal state, right?
Yes, it's
because
a federal state.
Even if we were to continue a state of emergency into September, but they ended in July, we're not going to get the money, right?
Yes, we're not.
Okay, so this is more federal than it is state.
Yes.
So in other words, just because we lift the state of emergency, local state of emergency, if the federal government still has their state of emergency, we're still going to be able to get the money.
For SNAP, we're not going to.
Why not?
That's the rule. For SNAP, once we end the PHE, we can only extend 1 month to issue the supplemental benefits to our...
And have we started to look at an exit plan? Or how are we going to be able to make up for this? Or are we just going to continue to accept, and once it comes in, it's...
That's why I'm saying, because more than 30% of the population of our SNAP...
Understood. And again, it goes back to an exit plan. If this money were to end next week, do we have an exit plan for that?
What I'm trying to say is that we don't have... Can the government sustain the need of the people?
And then hence why we have to have this conversation here, okay?
Yeah.
Okay? I apologize for sounding aggressive and speaking fast, but I'm looking at the time, okay? Then one last question. Who are we following, CDC or WHO?
Senator, we do follow, of course, the U.S. Centers for Disease Control and Prevention. However, we also make sure that we work with the WHO as well. And, it's all about data. It's about science to help give us guidance. Mm-hmm. To work with one and not the other would not be good planning and good fellowship. So, yes, we make sure that we track both of them.
Okay, so if CDC basically lowers our risk rate, okay, and basically says, okay, you can drop a lot of these mandates, but WHO says, no, we're still, worldwide, we're still in pandemic conditions. How long will we stay in this state of emergency?
Well, it's interesting because if you really are part of what's going on, mm-hmm. you'll know that science and data leads your way. Mm-hmm. So it's not just a matter of of following CDC or WHO. Those are recommendations.
But there's testimony
What
that
you
was
do
provided
locally-
earlier.
Yeah, sure. What you do locally is really ties in more about what's going on in your community.
Okay.
And so being part of that community and following science and data, as well as the physicians advisory group and so forth.
So at the end of the day, who do we follow, CDC
So at the end
or
of the day,
WHO?
we follow ourselves. We follow our science and our data that's occurring here locally.
So we're really not tied to whatever WHO, if WHO says the pandemic still
Senator,
exists in the world.
just to clarify, WHO and CDC will never prescribe mandates for states and territories. They will provide us with guidelines and recommendations, but the decisions for mandates and policies are left to the prerogative of the states and territories based on their local context. So that is implicitly built into recommendations by both CDC and WHO.
Okay. I'm trying to rush here, Madam Speaker. I was actually referencing your testimony, Dr. DeBitt, okay, in as far as that we should stay in the state of emergency until WHO says that it no longer exists worldwide.
I think it's important, Senator Frank, we've worked in prevention a long time. And we both believe in evidence-based action and using data to drive decisions. And the bottom line is our data for Guam shows that the virus is still around. And our risk level is still not in the low category. So we have to be guided by the data in making those decisions. But keeping in mind, it is a pandemic. It does exist in the world, and with open borders, for as long as the virus is circulating somewhere in the world, it is possible to reintroduce it into our community.
Okay, I just want to basically read. This is from your testimony. This is best accomplished by maintaining the state of emergency until such time that the World Health Organization declares the pandemic to be finally and truly
Yeah, we don't decide when the pandemic ends, Senator, because that is a global phenomenon, that is something that is decided by the WHO.
But you're recommending that we maintain the state of emergency until they do such time, right? That's what your testimony provides.
We have to consider all of these data, use the data to guide our decision making.
Okay. Well, I think that one of the things that we can see from here is maybe we need to have a continued discussion to help with regard to what an exit plan should be, okay? Or what are those areas that tie you to the state of emergency because of funding or your fear of what you could be losing, and see whether we can craft legislation so that we make sure that's maintained, okay? Nobody here is going to dispute the fact that, that we appreciate. First off, I appreciate everything that you guys all do. Okay? And that you continue to do. Just please understand that from our perspective, we have to look at other facets, other aspects of our community life, okay, that it has to come in sync. Because at the end of the day, when FMS and CMS decides, okay, we're going to stop the funding, how are we going to fund that? When you still need the nurses, how are we going to fund that? Okay, then that becomes our problem. Okay? So thank you very much for being here tonight. Thank you, Madam Chair.
Thank you, Senator Blas. Senator Adat.
Thank you, Madam Chair, and thank you everyone for being here tonight and for your testimonies. It appears that there's no distinction between the COVID mandates and the emergency medical infrastructure that must remain in place to deal with the surges, the treatments, and the prevention. Those that testified tonight in support want to end the mask mandates, the vaccination, the capacity limits, but yet those who were in opposition, they want to keep the medical services, the infrastructure in place, or even improve it. At this stage, I'm just kind of puzzled. Why can't we have both? Why can't we do both? Remove the mandates, but still keep the emergency there for medical services, treatments, surges. I mean, we're here because the public wants the mandates on freedoms to go away. But no one wants the medical services to go away. So, I mean, the only question I have, and I think it's a very grave concern is that of Ms. Gurusamy, who came in here and testified that, and so I'm not sure if she falls under public health or GMH or who, but she hasn't, the services for, has not been, that she rendered has not been paid for. And also the signing of documents with a physician's signature is very concerning. So the question I have is who allowed it and who's responsible for it? So we can hold someone accountable, because nothing like that should ever happen, emergency or not. Because an individual's licensure is at stake, so is his credibility. So that's the only question I have, Madam Chair, and I just like to get an answer from who does HSP fall under, and who's responsible for it.
So, Senator, I'll go ahead and respond to that, and that that is very concerning, and that's a very good question, and that does need to be investigated, and we do need to find out exactly what took place. I know she referenced March of 2019. I'm just going to assume that she meant March of 2020. But regardless of that, we too would like to have the answers. So I actually did a shout out to my director and asked if we should go ahead and schedule a time with her, and we will take it from there. And whether it's actually a public health or whether it's another division or agency or whatever has to be involved with finding out what exactly took place, we will bring them to the table as well. Okay, and we will get back to you.
Okay, thank you. I appreciate that. It's just something that it should have never happened and
Sure.
shouldn't happen again in the future. But thank you. Madam Chair, that's the only question I had. And I hope that we can come up to some type of medium here to where we can remove all the mandates but keep the medical infrastructure in place so that we can continue this receiving of fundings. Thank you.
And Senator, if I can respond to that, actually taking away the restrictions and sort of keeping the medical component is not unique to Guam. I mean, it is many places throughout the U.S. as well is faced with these same challenges. So they're not unique to Guam. I think what is unique to Guam is the fact that we are located so close into Asia and that there's so much activity around the Omicron virus and new variants that are going on in Asia and South Korea and so forth. So we have a lot more that we need to be monitoring in this area. I do know that our pandemic plan is actually on our website. It's for review. I encourage everybody to take a moment and have a look at that. As you know, many things are moving documents or living documents, so you always want to elevate and upgrade them and keep them current. But we're also unique in the fact that we all know our geographical location means that certain levels of inventory or services or protective equipment or vaccinations or blue tents or just whatever the case may be when it comes to supplying equipment, it's a process to get it here. So we try to stockpile, we do our best to do what we can to have things available during times of emergency. But again, as much as these situations are common throughout the U.S., we do have our unique qualifying factors that we have to keep in place. So actually, I appreciate very much the time the senators are putting on this. Just like Dr. Berdallo, we too, of course, know that there's a lot more that goes on besides what takes place in these walls. And at any time the senators want to come and visit our public health sites, and I don't mean like visit as in we're going to give you a tour, but I mean really spend some time there and see the caliber of folks that need to access services, whether it's vaccinations or primary care or well baby checkups or food stamps or Medicaid or TB or whatever the case may be. We are a melting pot of services, and we do encourage people to know exactly what we are facing on a daily basis. We would appreciate that. Thank you.
Thank you very much. Senator Moylan.
Thank you, Madam Speaker. I want to thank Senator Duenas for proposing the resolution I want to thank you, Speaker, also for having the public hearing, and especially want to thank the panel for your very clear and understandable explanation. We hope to have not come to this situation on 291-36 through the resolution, because we did have a bill on the floor, 1136, which would allow us to have this ongoing conversation, but it was overridden by the governor and vetoed, and we didn't have enough to override the veto. But 291-36, as my colleagues have expressed, has given this opportunity to have this open discussion. Dr. Berdalia, that's pretty good what you were explaining, that having the debate among your colleagues on the medical professionals. We don't have that with this administration. We're told to basically stay in our lane. But what's different from what the senators, this legislature can do, is that we are the checks, we are the balances, and we demand transparency. What we can do with this 291-36 on the resolution is we can continue as is. We can amend to ensure that the SNAP program continues as well. Or we can just end it. But obviously from this conversation, we need to relook at some other things. This is the people's house. This bill was authored because the people spoke. Those that co-sponsored it is because of what the people's voice that we heard. It's important that we hear all these testimonies, the pluses and the minuses which we have. This original law that put this pandemic emergency in place is over 20 years old, never implemented before. The Guam Code annotated Chapter 19 and Section 10, we understood a lot of things as we implemented it, just as we're learning what we had to do to battle the pandemic. We need to change this so we can have a better dialogue with the administration. The administrator is not our commander. We are a co-equal branch of government. This is the checks and the balances and the people's voice. And we didn't hear this until the resolution was authored by Senator Duenas. What the pandemic has showed us, it magnifies the situation of our hospital. Not because there's bad people in there, not because they're not doing their jobs. It's just because the government has supplied the necessary tools and finances, even though we tried in the 35th and 36th by giving millions of dollars, that we argued, where is it going? Because we haven't seen it. There are fantastic nurses working in a poor facility that is not their fault. So I thank you for what you've done and expressed to us. I thank the author of this bill, and I thank the speaker for having this public hearing. We're not trying to do anything bad. We are just trying to be the voice of the people and to exert our right to do the right thing. So thank you very much. Thank you, Speaker.
Thank you again to all my colleagues. I'm not going to be able to ask my questions tonight, but I want to thank you. I think you've done a very good job of presenting testimony and details that I think we really needed to have. And I'm sure the public is very grateful to know now many of those things. If the legislature needs to establish additional powers for certain agencies as we transition forward, I say bring them on, let's do it. And let's work together on that. We're perfectly willing to do that. I, for one, want Guam to avail of every benefit that is still available to us. I think our health system needs it, and so I would like to avail of those if possible. I am very grateful for the detail in the testimony that tells us exactly which services require a local declaration of emergency and which services are covered by the federal declaration of emergency. That is the detail that we have been asking for. And so I'm grateful to you to be providing that, and I'm asking you to continue to provide that. I don't think hiding that from anyone is going to be helpful. I think, as you have seen, we have uproar in the public because we can't share the same basis, you know? We have to start on the same knowledge, and I think that would be very helpful to everyone. You know, we're not privy to physicians' advisory groups or you know, advice to the governor. We are getting the conclusions. We're getting the opinions. We're not getting the facts. We get almost nothing in writing that shows us that that's what FEMA said, or that's what the rule is from whoever is providing these services or these benefits to Guam. And the more that you can provide that, the more credible all of it is. And of course, we want to assist. So that's my perspective. And I think that would all help us to operate on the same info. I particularly am interested in public health programs. We've had several oversight hearings, and they've had promise that there are programs that they are putting in place that are going to become permanent. We haven't really seen that, and you know, it's kind of like we're threatened that those aren't going to be permanent if we move on from this emergency. But we all agree that with our healthcare system the way it is, we need the homebound services, right? Operation Homebound, I think. Those type of things. I think, Dr. Wen, we've had that conversation in oversight hearings years ago, right? Maybe 2 years ago. That, yeah, we understand, and we want that, and we want to help that. We want the permanent programs to quickly trace any other contagious disease, right? To be permanized. That's what public health has promised, but we haven't seen that. Those types of things, of course, and I appreciate, you know, your perspectives tonight on the uniqueness of Guam's situation. And I want you to know that I, for one, am going to take those very seriously. So, again, thank you to all of you. I'm going to ask the sponsor of the resolution to close.
Just Masi, Madam Chair, very quickly. You know, as Senator Moylan has said, and every single one of us here tonight are sponsors of Bill 11, a bill that would bring us down here every month to do exactly this. And with all due respect, Terry, I have no problem visiting with you and coming up. I'll bring the donuts and the coffee. But the fact is, the decisions are made here. And the conversation and the dialogue that the community needs to hear emanates from here. And Senator Moylan's right. We can go back and amend this, and this is the process. We can go back and amend this resolution to take into consideration everything that's been said tonight and keep and maintain those things that are medical related, and keep and maintain those things that are National Guard related, if necessary, and keep and maintain and figure out how to make sure public health is all set. And at the end of the day, if we want to make a statement about mandates, we could do that. But is that the right way to do it? I would hope my colleagues would join me and override Bill 11. And then we do this once a month, so that the people of Guam see, hear, smell, and taste everything we do. If there wasn't that stubbornness, we don't have to be adversarial. And yes, I know everybody's tired. I'm tired. Everybody's tired. But the exit plan is also designed to make sure that we have that balance with our community, talk to the business community and everybody else that has to have a plan at some point. Because everything I heard tonight, a public health emergency can continue for ad infinitum for medical reasons. And also, there's no certainty in terms of what GVB and other people are trying to do to make sure the balance is there for our economy. Regional aspects, everything else, there has to at some point be an alacrity of the ability to move in and move out so that we all work together. That happens here. I would gladly withdraw this resolution if I can get my colleagues to override Bill 11 so that we do what we're supposed to do. Sit down at the table at least once a month and make decisions that are clear to our people and that show that we're taking into consideration everybody's voice, like everybody else that came out there today and like all of you. And you don't all have to be here. I'm sure we could condense it down, but that's the way to work together. That's the way it has to be. Otherwise, it will always be adversarial. Jesus Masi, Madam Chair.
Jesus Masi again to all of you and to all of your agencies for all the hard work and for even the work that you had to do to put into the testimony tonight. I appreciate that. And we are forever grateful for what you have done during this emergency. Please don't take this as any other indication. We are very grateful. We want to continue to have dialogue. We need to move our policies going forward, so we need to work together. Situs Masi. We will now, the Committee on Health will consider Resolution Number 291-36 COR duly heard. Public hearing is now adjourned. The time is 10:20 p.m. Situs Masi.